Well, gallstones are very common in the society. Approximately 30 to 35% of the population has gallstones. However, not everybody exhibits the symptoms of gallstone disease. Out of this 30 to 35%, only 5% or so end up with problems due to gallstones. What leads to formation of gallstones is multifactorial, especially seen in women childbearing age and women in between their 40s and 50s. When there are hormonal changes, gallbladder gets very sluggish, which leads to crystallization of cholesterol crystals, leading to formation of gallstones. They also are seen in men, but for a variety of reasons, men are present late with their symptoms and present in their 60s and 70s with gallstone disease symptoms. As we discussed before, not everybody actually has symptoms, but if somebody starts developing symptoms of gallstone disease, then the only option is a surgical option. Most of the times, the textbook symptoms are pain, especially in the upper part of the tummy and the right side of the tummy after having a heavy meal. As described, these symptoms can vary between just a generalized ache on the right side to full-fledged abdominal pain with fever leading to a hospital admission. Most of the time, the pain is in the middle to the right side and goes in a band-like fashion to the back. This lasts for about 3 to 4 hours and subsides on its own. And sometimes the patients do have to take analgesics like paracetamol. On different occasions, however, the pain doesn't subside and keeps on the intensity and lasts for 10 to 12 hours. If this pain is accompanied with fever, then unfortunately it's the next stage called cholecystitis, and in those cases antibiotics are required, and that is a condition which we would not like the patient to be in. Sometimes the gallbladder stones can cause other problems like traveling across the bile duct, causing more serious problems like pancreatitis and obstructive jaundice. If somebody started having symptoms due to gallstones, then surgery is the only option. Surgery is normally performed by keyhole or laparoscopic method. 4 small puncture wounds are made in the abdomen and the gallbladder is removed. Normally this is performed as a day case. That means the patient comes in the morning and goes home in the evening. 95 to 99% of the cases now in the UK are done using keyhole or laparoscopic method. The advantage of doing this by keyhole is the pain is less and the recovery is quite quick. In about a week to 10 days, patients up and about doing almost everything. As opposed to in the olden days, we used to do an open operation. The pain was more and the recovery was prolonged. This surgery is safe. It is very commonly performed both in the NHS and in the private sector, and is the standard of care. There's nothing you can do to prevent, but if somebody has gallstones, they form. However, you can prevent the intensity of the attack. So normally low fat or a bland diet is recommended once people start exhibiting symptoms of gallstone. That is because if somebody has a bland or a low fat diet, then the intensity of gallbladder contraction is less, leading to less pain and less severe attack. That's what we can do. However, if somebody has frequent attacks, then the surgery is the only option.